Hello and welcome to COVID Conversations here on WNCU 90.7 FM. I'm Kimberly Pierce Cartwright, your host, and I'm the News and Public Affairs Director here at WNCU 90.7 FM. And we're using this platform here on Zoom to talk about how COVID-19 is affecting our world. And today I have as my guest Dr. Christopher Paul. He is Assistant Professor and MPA Program Director in the Department of Public Administration at North Carolina Central University. Hello and welcome, Dr. Paul.
Thank you so much, Kimberly. It's really great to be here.
It's really, really great to have you. And we're going to talk today about a study conducted at North Carolina Central University that finds that high levels of hunger exist in North Carolina as the holidays approach. I want you to first tell me what it is that you do.
Yeah, absolutely. So I have a great job in the public administration department because we are a professional master's program. We're actually the second largest public administration master's program in the state, and really the second largest graduate program at NCCU. And so we cover a lot of important issues with students, many of whom are already practitioners working in their communities. And so it's a great fit for me because I have a background in interdisciplinary research and public policy. My interest is in environmental health and how communities react to stressors and challenges they face. And so that is absolutely true during this time of COVID, where there are so many threats to us as communities, beyond just the disease itself, all the challenges that people face about not being able to work, not being able to go to school, and unfortunately not being able to access adequate food in many cases for lots of different reasons. And so I knew with my colleagues, in particular my colleague in the Public Administration Department, Dr. S. Nicole Diggs, that we had to address this issue of food security during COVID in our work and understand what communities are doing to respond. So I have a pretty broad background in public administration research, but it all comes back to this question: like how do we react? How do we take care of each other? How do we take care of each other in concert with through our organizations, whether that's a local community organization or a local government? And so that's what we're trying to do in this particular study, looking at food security during this COVID pandemic.
So how did it come about that the research will be conducted here at NCCU? Was this your interest, or was there some outside organization that offered funding? How did that come about?
Yeah, absolutely. So this survey came about by working with the HOPE program at NCCU and the Research Center for Minority Institutions, which became a larger program called the NCCU Accord Center, or the Advanced Center for COVID-Related Disparities. And it's being coordinated by Dr. Deepak Kumar, and then a HOPE program focused on a certain focused counties in North Carolina and Central North Carolina with Dr. Fred Pilkington. And so with this program, eventually they got funding from the state through the North Carolina General Assembly, and then with the administration of the North Carolina Policy Collaboratory based at UNC Chapel Hill, that provided research funds to NCCU. In fact, $1 million came to NCCU to look at COVID responses. And so there's a lot of projects associated with this funding, and ours on food security is one part of that. I had already been working with a faith-based organization in Durham to understand how they respond to food security. Mount Level Community Haven is the name of that organization. And so last year, really not so long ago, we had talked through what they do in a number of different ways to respond to community well-being through food security and enhancing food security. And so it was only natural to then wonder and worry what was happening across our state as COVID hit with regards to food security.
So then with the broad umbrella, then why is this research so important?
Yeah, this research is so important for a number of reasons. I mean, one is the situation's changing really rapidly. And so with food security, this is a pretty good example, I think, of why what we're doing is important, is that traditionally food security is measured by the Census Bureau, and the United States Department of Agriculture has a food security survey that they do regularly. But historically, it's updated on a quarterly basis or an annual basis. And it's not connected necessarily to a specific geographic region, but we knew that the situation was changing rapidly. And so we wanted to conduct surveys in our target communities as well as across the state that we could do rapidly to understand where where households' food security stood and how it was being affected by COVID. The North Carolina is being heavily impacted by COVID. It's not the highest rate of COVID in the country, but the impacts are huge. Our level of hunger, as we will talk a little bit more in this survey, are really high. But the disproportionate effects of COVID on minority and particularly African American communities is huge. And so having North Carolina focused research to understand the impacts of COVID and then how do we respond is critical. And a big part of the larger project with the Accord Center that Dr. Kumar runs is to look at how African American communities in particular and underserved communities more generally are being reached with testing, which the Accord program, including us, are doing specifically. And we have a testing event on December 19th, I think, in Durham, as well as one in Wilmington. But that these testing events help provide access in communities that aren't otherwise getting testing events. And then we're also, as a big program, the Big Accord group run by Dr. Kumar, trying to understand what the barriers are to getting tested. To getting tested and then to getting the vaccine. So how do people perceive the vaccine? And so the larger project is working on understanding that and working on communications and partnerships to help enhance access to testing, care, and vaccines moving forward. And so my project with Dr. Diggs is looking at a subcomponent of the impact on food security and basically what are the resources that households can call upon to take care of themselves.
So how many people are we talking about that don't have food in North Carolina?
Well, so this is a good question. I mean, we're talking about millions of people. Our survey can't put a precise number on it, but what I can say is that our survey indicated a huge increase in hunger. So when we asked respondents across the state, so from almost every county in North Carolina, through this internet survey, if they had a day in the past week where they hadn't had enough food, 17% of those respondents said that there was a day where they hadn't had enough food, where they were food insecure. And we actually asked a number of other questions as well, but that's sort of the headline question, and the one that I think hits it home, because that survey we administered November 17th to 25th, right before Thanksgiving. And to think that there were 17% of households in our survey across North Carolina who didn't have enough food right before Thanksgiving, really hits home the impact and the scope of this tragedy. But historically, North Carolina's rate of food insecurity has been around 12 or 13%. And so 17% is quite high if it, just sort of making that comparison. And it means that the millions of people, and especially, millions, especially millions of people, and especially households with children are food insecure in North Carolina.
So you said that this was an online survey. So how were the respondents chosen for the survey?
Yeah, so we used an internet-based survey that's a panel survey, and the way we do this is with a quota-based sample. And panel surveys, like these internet panel surveys, are people who opt in to take surveys. You may yourself have gotten invitations to take online surveys, and we contracted with a well-established, well-known internet survey firm that has a good reputation, has a good structure, and so they manage that quota. And so so it's not a random sample, which is important, especially if any research method students out there are listening. It's not a random sample of North Carolinians. It's very hard, say, to access people randomly across the state. And so internet surveys are a way to quickly reach people. And what we can do with quotas is to help ensure that the people who are responding represent North Carolina. And so we were able to get a survey that had a large number of African Americans and Latinos respond. People from, we also ensured that people came from different county demographics, and that people came from different income levels. And so with that, even though it's not a random sample, it's a sample that has respondents who represent characteristics similar to some of those major demographic categories for North Carolinians.
So I want to just talk about something that I saw when I was reading like the presser for this. And it talked about like some of the findings. One of the findings said that 77% of households were considering a shared meal with people outside of the home on Thanksgiving. And that was despite like officials saying, don't move, stay at home, have union with people who were in your particular bubble, maybe at home. But 77.4% of those households said that they were not going to adhere to that they were going to go out and socialize with other people. And I want to know, did that surprise you in the survey?
It was surprising in a sense, but I think it also was really consistent with what we know is that people really need that social connection. I thought this was an important thing to ask because it shows that intersection between food and well-being and health with COVID in a really explicit way. It was a beautiful day on Thanksgiving, and so I hope many people ate outside. But unfortunately, we know that we've had a big spike of COVID since Thanksgiving, and that those gatherings really do provide a key route for transmission when people gather in small spaces together with people outside their homes and unmasked, and you can't eat with a mask on. So it's not really possible to be inside for a meal safely with COVID with people outside of your home. I'm hopeful we'll have another pretty day for from North Carolina and in the country on Christmas, that people might still choose to brave a little bit of the elements and eat outside. But I think it represents a real challenge that we need to stay connected to people. There's no doubt we need to take care of each other. And so, but we also face this huge threat from a very dangerous disease.
Now that you have your findings and you've done the survey, what happens next?
Well, it's a great question. I was just having a conversation this morning about it with my colleagues. We one of the things that Accord is doing and that the HOPE program is doing is building a mobile food pantry and health mobile that we will launch next year and in the spring. And it will have one of the things that we hope to do, and we were just talking about, is having partnerships with local food security agencies. So not only will we have this food pantry so that when we come to do health promotion events throughout counties in North Carolina, in our HOPE counties, we will also be able to have a local food security organization like a food pantry there to provide some continuity and a partnership. And in addition, hopefully have things like nutrition classes and cooking classes with some of our local experts to help encourage sort of that holistic look of food security, not just getting basic access to food on one day, but figuring out ways to improve people's food security for the long term. And it will be a long recovery here out of COVID. And so that, these types of efforts are going to be important, not just getting us through this winter, but to recover the long-term recovery for households.
Well, we're just running out of time. If anybody wants more information about what you're doing, how can they get it?
Yeah, absolutely. Well, you can find us, find me and my colleagues at www.nccu.edu/accord, ACCORD, and or /MPA for the public administration program. And you can easily find me on NCCU's website.
Very good. And thank you very much. Our guest today, Dr. Christopher Paul, and he is the Assistant Professor and MPA Director in the Department of Public Administration at North Carolina Central University. Thank you so much for your time today.
Yeah, thanks for having me. It was great to talk.
You're welcome. And thank you, audience, for watching and for listening to COVID Conversations here on WNCU 90.7 FM. I'm Kimberly Pierce Cartwright, your host. Until next time.